Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Allahumma salli ala sayyidina wa maulana Muhammadin an-nabiyyil ummi wa ala alihi wa ashabihi wa barik wa sallim. I am Dr. Mudassir Shahbaz, Associate Professor of Anatomy, Sahara Medical College, Narwar. And today we are going to learn or understand about the joints of the lower limb, especially the superior inferior tibio-fibular joint and ankle joint. So before start our learning these joints, I want to discuss with you certain points, and these points can be applied to any of the joint which you are going to learn or understand. So before we start our discussion on these joints, you should try to recall from your previous knowledge, because you have already studied or understood about the hip joint, and also when you were learning about the upper limb, you have learned about many joints in the upper limb. So you know the joint, and also while you were studying or learning the general anatomy, and there the specific chapter of the joints you have learned about, you have seen that chapter also. So what do you want to learn about these joints? There must be certain questions which until now you must have in your mind, that you want to clarify these answers. So here for example, first point is where are these joints in your own body? It's not the O, it's own. I will try to put here the O is not O, it's own, in your own body. So I correct it, and now I can come back. Now try to locate these joints in your own body. So if you want to learn about the superior inferior tibio-fibular joint, now you can locate these joints. You can locate the anterior border of the tibia, and if you roll your hand on the lateral side of the tibia, above, you imagine that here you can feel the head of fibula, and it's making a joint with the lateral condyle of the tibia. Below, you can feel your lateral malleolus. So it is actually the extension of the lower end of the fibula, lateral malleolus. So, and here this lower part of the fibula must be making joint with the lower end of the tibia. And if you feel both the medial malleolus and lateral malleolus, these malleoli are covering over the ankle joint, forming the ankle joint. So you can feel these points. So try to locate these points on your own body. So which bones are taking part in making these joints? Between which bones are these joints actually? So if you recall them, you want the answer, and you know already the certain answers, but other answers you want to learn about that. What is the type of these joints? Are these joints are synovial? Are these are fibrous? Are they mobile freely? What is the type? You want to know that. And how these joints are stabilized by these ligaments, muscles, and other factors. So you want the answers of these things, which should be beforehand in your mind. Now, before starting your learning, about 80% you are clear in your mind that what you are going to learn about these joints. So you want to know certain things, so you have questionnaire, clear-cut questionnaire in your mind that you want to learn these things. Last but not the least, which is very important that you need to know, is that move the joint in the possible directions, all the possible directions, such as ankle joint. So you have ankle joint with you. try to move your foot over the ankle joint. Now you upward, downward, then rotating your foot medially and laterally, and you want to produce all these movements. So you want to name these movements. If you are moving with your foot upwards, what type of is it extension? Is it dorsiflexion? What is it? You want to know. You want to learn about. If you are moving your plantar surface downward, is it plantar flexion or simple flexion? And you want to know what are the muscles which are responsible for these movements and how they produce these movements. These questions should be in your mind beforehand. Now you use the available sources to understand and find answers to your questions, and the sources which are available to you at home are the atlas, diagrams, books, and the very important source is internet. There is no shame that you should use internet. We both, teachers and the students, should use the internet to improve their understanding. And nowadays, you know very well that there's a huge knowledge which is available on the internet, and you should know how to use it. I know that you already know it, but you should use it for the purpose of understanding. Mind it, try to learn and understand the things. Do not try simply to memorize the things as they are written in the books. This is a very ridiculous, and it is very embarrassing that you start simply open the book, open the chapter of ankle joint, and start memorizing the about the joint. What is the joint? What is the type of joint? It's not like that. You want to understand it, and you want your answers. So try to learn and understand the things. Try to raise the questions. It's not simply to memorize the things as they are written in books, such as a very famous book which is very much liked by the students is B.D. Churasi. It's a marvelous book, but it's not the way of learning and understanding simply to memorize. Try to understand the things, try to learn the things for the long-term purpose. Now we come to the joints. First joint is the superior tibio-fibular joint. So what we are seeing here is the upper end of tibia, here is the upper end head of the fibula, and here we are seeing that it is making joint with the tibia. And here another diagram showing this. And in this diagram we see that it is connected by here, the femur is connected to the tibia by a ligament here, and is the lateral condyle head of. And now we see what type of joint is. Here we see it looks like a plain joint, and it is a synovial joint. It means certain type of movements will be occurring in this joint between the head of fibula and the lateral condyle of tibia. Some passive rotation of the tibia around its axis, and here we see around its axis the passive rotation of movements is occurring. Here the two are away from each other, lower end, but here they are closer together. So here it is moving outside, here is moving inside. So there is a passive movement of rotation occurring in this. That's why this joint is synovial joint. And its cavity here, we can see if here would be its cavity, it must be communicating with the inside the joint. And here we know that is the tendon of the popliteus muscle that move inside. So through that it may communicate with the knee joint, the capsule of the superior tibiofibular joint. So we have answers to our questions that this joint is between the lateral condyle of tibia and head of fibula, and this is a synovial type of joint, and it is a plain variety, and the movement that is occurring are the passive rotations around an axis is around its own axis. So we have understood that. And why this? Because the lower end of the tibia at the ankle fibula at the ankle joint is moving away and towards the lower end of the tibia. So that's why while your pressure or weight is produced downward, is the movement is occurring at the upper superior tibio-fibular joint. And what we have learned that it must, if it is a synovial joint, it must be having a synovial membrane and a capsule, and the capsule is at the articular margins, and the synovial membrane, it may, as it is very much near the knee joint, so it may communicate with the knee joint, and through the tendon of popliteus muscle. So now we have understood about these things. Okay, so now we know about the superior tibio-fibular joint. Now, if now is the distal tibio-fibular joint. So here we see lower end of the tibia and lower end of the fibula, and they are making a joint here. So what is, if this joint is here, what kind of this joint is? Is a fibrous type of joint. Syndesmosis, articular surface, fibular notch, articular with the distal end of fibula. Fibular notch is where? Over the distal end of fibula to form the fibular notch is on the tibia, and the distal end of the fibula to form the distal tibio-fibular. It's a syndesmosis. Connecting material is the interosseous membrane or the ligaments. So what is syndesmosis? Here your previous knowledge will apply. That do you know about the syndesmosis or not? And syndesmosis, if you go to the your general anatomy knowledge, then you can learn that the syndesmosis, where the bones, they are connected by the ligaments or the membranes. And the special thing about these joints is fibrous joints is that the movement, they can be immobile or very slight movement can occur on these joints. So because they are not synovial joint, they are syndesmosis, fibrous joints. An example is the tibio-fibular joint, distal and interosseous membrane, which is connecting between the two bones, and these are, as you know, in the upper limb between the radius and ulna, and in the lower limb also between the tibia and fibula, interosseous membrane is present. So these are the examples of the fibrous joint or syndesmosis. So either a very little movement or no movement is occurring in these joints. So coming back to the distal tibio-fibular joint, we have almost fulfilled our question here, that this joint is between the fibular notch over the tibia at the lower end and between the distal end of the fibula. And what type? It's a fibrous type. Movements, obvious, almost no movement is occurring on this, or very slight movement of occurring, as you can see that only they are separating apart and coming closer together. So these are, we have fulfilled our the requirement of understanding the joint. Now, ankle joint. First of all, to understand the ankle joint, we have to see how this, between which bones actually this joint is forming. Here we are seeing the bones which are taking part in the ankle joint. Here is the lower end of the tibia and fibula, and here is a bone which is named as talus bone. And below the talus bone is making joint with another bone, which is the calcaneum or the heel bone, over which heel is present. So actually, if we see this, actual joint is between the ankle joint is between the tibia and talus and fibula. It seems like that the tibia and fibula, it is making a socket in which the talus is fitting. So making the ankle joint. Below this talus, the other bones are present which are making joint with each other. So these joints are not actually the part of ankle joint. These are the joints which are present below the talus. So it means that these joints must be subtalar joints below the talus. So we have seen, we have understood about the bones. Now we go to the detail. First of all, we have to understand the talus. Here in this diagram, the two bones are shown. Here we are seeing the lower end of the tibia. Here is the medial malleolus. Here is the lateral malleolus, extension of the tibia and the extension of the fibula, and thus making a socket. Here is the tibial lower part, posterior end of, anterior end of the tibia. In this socket is fitting this bone, the tarsal bone. Here we can see this. If you have studied the tarsal bone, you can name it the head of the tarsal bone. And here you can see its shape. Its distance is anteriorly, it is wider than its posteriorly. So it is fitting into the socket made by the tibia and fibula. So it's a trochlea which is fitting into the lower end made up of tibia and fibula. So if this is trochlea fitting into it, so the movement can occur only into the two directions, in the one direction, and in around only one axis. So keeping these things in mind, trochlea is of the talus has three articular surfaces above inferior surface of the tibia. Trochlea is wider anteriorly and posteriorly, medial malleolus, lateral malleolus. These are the bones which are making the ankle joint. Here we can see it. Now here also we can see, here the talus bone is shown. It's making a wedge. Inferiorly it is making joint with the calcaneums. Anteriorly it is making joint. Here is the head of the talus bone. Here is the neck, and here is the trochlea for the ankle joint. Okay, now we have understood about the shape, how this joint is made. Now other joints, the which are below this joint, we before we start the other specific things about the ankle joint, we should have a knowledge about the other joints which are not actually included into the ankle joint, but these we can study afterwards. These are the subtalar joint, means below the talus bone. Here we can see the subtalar joint between the inferior surface of the body of talus and superior surface of the calcaneus. Talo-calcaneo-navicular joints. Talo, calcaneo and navicular joints. Here you can see talo-calcaneo-navicular joint. It's also a synovial type of joint. Here's the head making joint with the navicular bone, and the posteriorly, if we go, the body is making joint with the calcaneum, and a ligament is connecting these bones, which is named as spring ligament. So this spring ligament, navicular bone, calcaneum bone making joint with the head and body of the talus bone, that's make talo-calcaneo-navicular joint. So here a special thing that we have learned, what we have seen, is that one thing which is not a bony but it's a ligamentous structure, that is the spring ligament, superior surface of the spring ligament, and the sustentaculum tali of the calcaneus on other side. These are making the part of the joint, a ligament which is making part of the joint. Another joint which is shown is the calcaneo-cuboidal joint. So if we see this bone, here is the calcaneum and here is the cuboidal bone. Here is the navicular and here is the cuboidal bone. Here it is making joint with the calcaneum. So calcaneo-cuboidal joint is another joint which is included in this tarsal joints, you can say it's also synovial, and it's between the anterior surface of the cranium and posterior surface of the cuboid. So we have understood up till now about the joints and the other joints which are differentiated from the ankle joint. So as we have understood this, now we go to the ankle joint. What type of is? If it is a trochlea fitting into the lower end of the tibia and fibula, so it's a type of hinge joint. Now recall in your mind about the articulation between the lower end of the humerus and the trochlea made by the ulna bone. So that elbow joint was a hinge joint. So similarly, here this joint should be a hinge type of joint, of synovial joint. So it means that in this joint only two movements occurring around transverse axis, that is the backward moving of the foot and plantar moving of the foot, that is the dorsiflexion and plantar flexion. So it's making a deep socket made by tibia and fibula, which will form a mortise, and trochlea of the talus. These are making the joint. So this joint is a hinge type of synovial joint in which the socket mortise is made by the tibia and fibula and trochlea of the talus. They are making the joint. Now capsule. The other thing, then if we have understood this, between which bone the joint is present, ankle joint, and also we have understood that what is the type of joint, we have got our answer. So we want to know the ligaments, and the in the synovial joints, the very important ligament, which is the capsule of the joint. So here is a true articulation in one capsule. So distal end of tibia with the talus, distal end of the fibula and lateral aspect of the talus, and capsule cover distal tibia, malleoli and talus. So here the capsule, this covers two articular surfaces. So here we see attachment of the capsule of the ankle joint. So it is above to the articular surface of the tibia and malleoli, and below to the talus around the upper articular margin. It's obvious. And attaches to the hollow on the medial surface of the lateral malleolus. Medial surface of the hollow, between the hollow, medial surface of the lateral malleolus. It attaches there. So it is fairly thin and especially weak anterior and posteriorly because the movements occurring there. Laterally the capsule is thickened, and it will form the ligaments. So we have understood about the capsular attachment. Obviously it's very simple, as we see in the other, it will be on the articular surfaces, articular margins of tibia and malleoli, but if we see laterally, the hollow bit on the medial side of the lateral malleolus, here also the attachment of the capsule, and below it is over the trochlea of the articular surface of the talus, right? And it is thin and weak anterior posteriorly. If you move your ankle backward, dorsiflexion and plantar flexion, you can imagine that it must be weak here to allow the movements, and laterally, so that the joint should not dislocate, the capsule is thickened. Synovial membrane, obviously it will line the capsule, and it's reflected over the neck of the talus and extends upwards between the tibia and fibula to the interosseous ligament of inferior tibiofibular joint. It's covered the fatty pad and in relation to the anterior posterior part of the capsule. So it will line the inner side of the capsule, and reflection is over the neck of the talus and extend upwards between tibia and fibula. Ligaments which will support this joint These are the some on the medial side and lateral side, and this must be very strong ligament so that the joint should not dislocate during the movements. As you know that very well, you can imagine that we use this joint in walking, very much in walking, so these ligaments should be very strong one. On the medial side, the deltoid ligament, it's shaped like the deltoid. It's a very triangular ligament. The apex would be over the medial malleolus, and base subdivides into four parts. One goes to anterior tibio-talar part, tibio-talar part, anterior, tibio-navicular part, tibio and to the navicular bone, tibio-calcaneal part, from the tibia going to the calcaneum, posterior tibio-talar part, and posteriorly tibio-talar part is there. So four parts of the deltoid ligament are there. Anterior tibio, and here we can see in the diagram also. You can have the such diagrams on the internet very much. In my opinion, you should search for that. Regarding the lateral ligament, is composed of three separate ligaments. One is the anterior tibiofibular ligament, other is the calcaneofibular ligament, and other is the posterior talofibular ligament. So anterior tibiofibular ligament, calcaneofibular ligament, and then is the posterior talofibular ligament. So three separate parts of the lateral ligament on the lateral side. See further, a spring ligament. Spring. A spring ligament means that it's not like the spring atom, but it springs, that it has the ability to expand, or it act like a spring-like action. Officially, it's a plantar calcaneo-navicular ligament. Calcaneo navicular ligament between substanticum tali and navicular brain. So here the substanticular tali, and here is the navicular brain. So here is the spring ligament. Form part of socket of the head of the talus. Here the head of the talus. So here the socket will be formed by the, here should be the ligament, and it will form complete the socket for the joint. Important in maintaining the medial longitudinal arch. So as it like a spring, so when the medially the arch try to expand, and when foot is off the ground, it again comes and keep the longitudinal arch, maintain the longitudinal. This is because of this spring ligament here. So from this we can understand that if MCQ comes in the exam that about the maintaining the medial longitudinal arch, if it is written that the spring ligament is very important factor in maintaining the medial longitudinal arch, so that will be very correct answer. Okay, so spring ligament. Posterior tibiofibular ligament is very important between the malleolar fossa of the fibula and the posterior edge of the tibia. Here is the posterior tibiofibular ligament. Here it prevents the leg to slide forward on the talus under the influence of gravity when foot is plantar flexed in walking. Here you can see the foot is plantar flexed while walking, and here it tends to move forward, but this ligament prevents this forward sliding forward of the talus. This prevents this prevented by this tibiofibular ligament. And another ligament here is the talofibular ligament between the talus and the fibula. It also help in dislocation, preventing the dislocation of ankle joint when the foot is plantar flexed during walking. If we go further, so now we can claim, we can tell the stability of the ankle joint, how it is made stable. First factor is that it is a mortise, that the socket and a trochlea. Other factor is the ligaments. We have seen the medial deltoid ligament and lateral ligament, lateral malleolar ligament, and tibio-fibular ligament. We have seen that. So these ligaments are taking part in the stability of the joint. So there are the muscles which are crossing the joint from the leg into the foot to produce a movement at the ankle joint. These muscles, tendon of these muscles, they must be providing stability to the joint. So one the question is that forward sliding of the leg on the talus is prevented how? When you are walking and you are plantar flexing your ankle joint and the foot and moving your body forward. So what are the factors actually which prevent the forward sliding of the leg? These are the posterior lip of the tibia, which is deepened one, and posterior tibio-fibular ligaments. This is the answer. And the superior articular surface of the talus is wider wider in front than behind. So what is the benefit of this? So joint is unstable in the plantar flexion, walking downhill, and more commonly sprained while walking downstairs than when going to the upstairs. This also explains that the women who use the long heels and in which their foot is already in a plantar flexion with the long heels, when they are walking, they are just walking like they are coming down hills or walking downstairs. So there are very much chances for those women, for those ladies to have sprain or the dislocation of the ankle joint. Okay, from this shape of this we can understand this. Now is the joints of inversion and eversion, that is the mid-tarsal and subtarsal joints. So we will discuss these joints separately, but for the purpose of description they are given here: mid-tarsal and subtalar joint. Mid-tarsal joint are between the head of the talus and the navicular lines in the line with the calcaneocubital joint. So these two joints, calcaneocubital and the talonavicular or talocalcaneo-navicular joint, this is called as mid-tarsal joint. Subtalar joint, articulation between the head of the talus with the spring ligament and subcircumtali, anatomical subtalar joints. So here the between actually you can say talocalcaneo-navicular joint is a subtalar joint. Talocalcaneo-navicular joint will be the subtalar joints. So mid-tarsal and subtalar joints. You can see here mid-tarsal. This is the calcaneocubital joint. Here is the between the head and the mid-tarsal articulation of the head of the talus with the navicular line lies in line with the calcaneocubital. They are very much in line. Here you can see. Okay, and now the movements of the ankle joint. Movements, if you have already moved your foot, you can see, you can dorsiflex it, you can plantar flex it, you can invert it, you can evert it. Dorsiflexion, some degree of rotation, inversion and eversion is possible when the foot is plantar flex. So in this sense, the joint is relatively unstable during plantar flexion, and this is mainly because of the shape of the trochlea of the talus. Movements: plantar flexion, dorsiflexion. Ankle inversion, ankle eversion, and flexion of big toe and flexion of the little toes is a separate one. Ankle and foot joints muscles involved in the dorsiflexion. The muscles will be on the anterior side tibialis, anterior extensor digitorum longus, plantar gastrocnemius, soleus, and the other joints which are passing behind the medial malleolus. We will see that. Inversion, the joints which are on the medial side will try to pull the foot inwards, and eversion are the other muscles we will see in other also in the detail further also. Alhamdulillah. An inversion is an act of movement in which the plantar surface of the sole of foot is rotates towards the midline of the body. Just like it's if you compare it with the pronation and supination, you can understand this. And there are the two major muscles saying. So movement is eversion. Eversion is by the accessory movements. This is the movements dorsiflexion, plantar flexion movement. Dorsiflexion, these are the muscles. Plantar flexion, these are the muscles. Eversion, the peroneal muscles are located in the lateral side. We know that, you have learned it already. And the peroneal muscles are known as fibularis muscles also, fibularis, longus, brevis, and tertius. And these are the muscles of eversion. Now is the ankle sprain, the clinicals of the ankle joint, and we will see these and we will discuss in our next lecture, and we will also see the subtalar joints in detail and about the discussion about the clinicals of the ankle joint. I think so. Thank you very much, and we will see later on. We will continue discussion on this. Try to learn this and try to apply this. You will understand it, and I hope so that you will not forget this. Thanks a lot.